The following segment has been paid for by AlzInColor, a national awareness initiative from Links to Equity. As Black History Month comes to an end, health advocates are urging families to not just honor legacy, but to protect it. While Alzheimer's doesn't see colors, its impact is not felt equally. Early conversations about brain health and memory issues can lead to better outcomes, and there is an initiative designed to help it called AlzInColor. Joining us now with more is dementia care expert Dr. Farron Epps. Welcome, Dr. Epps.
Thank you for having me.
So the numbers surrounding Alzheimer's rates are pretty crazy, yet this is a topic that many minority families kind of honestly avoid talking about. Why is that?
Well, I think you're saying the numbers are crazy, but many times these families in these communities, in the Black and Latino communities, they don't know these numbers. They don't know the statistics. They don't know that Black Americans are twice more likely than their white counterparts to be impacted by Alzheimer's disease. Latino families are 1.5 times more likely. So this is so important. So we need to provide this education, but also in Black and Latino communities, they don't have access to resources and supportive programming. So AlzInColor, we're trying to change that. And so we want to empower our families and give them the information that they need so they can start having these conversations, these honest conversations around brain health.
Yeah, and even as we celebrate Black History Month this month, conversations around memory loss and Alzheimer's, like you said, should continue throughout all communities of color. Why is it important, especially for women, to start to have these conversations?
Well, when you look at dementia, 68% are women that are serving as caregivers. But also when you look at our communities of color, many times the women has this role of being the CEO of health for their family. And so they got to have this information so they can start having these conversations. Because if they don't do it, it may not happen.
Yeah, they're kind of like the backbone, literally, of the entire family. So what are some steps that we can start to take before symptoms appear, and what are some early signs that we should be on the lookout for?
Yeah, so before symptoms appear, and I want to make sure everyone knows that you can start having changes in your brain 20 years before you start seeing symptoms and signs. So it is important, no matter what age you are, to start engaging in brain health activities. And the U.S. Pointer study came out last summer showing how there is lifestyle change interventions that can reduce your risk. But some key things you can start doing now is eating a healthy diet. So what's good for your heart is good for your brain. Exercising, sleeping more, social engagement. These are things that are very important. And then also knowing your numbers. So knowing what your blood pressure is, your blood sugar is, those are things that are equally as important to help us reduce our risk of getting dementia. But then you asked about what are some early signs, right? What should you pay attention to? So many times we think about memory loss and forgetfulness, and that is one of those things, but it's to the point where it's maybe misplacing items and you're unable to retrace your steps. Also, not being able to complete familiar basic tasks and drastic changes in your personality. Those are just a few things that you may see. And if you see this, you want to share with your family your concerns, but also share with your healthcare provider.
Yeah, so where can we go for some more information on everything you just told us about?
Yes, please visit our website, AlzInColor.com, and we are here to support you.
Perfect. Well, thank you, Doctor, for sharing all this with us.
Thank you.
And thanks again to AlzInColor for sponsoring that conversation.